Hello everyone, in this video we are going to see about mucormycosis, very commonly known as black fungus. It is a rare but a serious condition in which the moles mucormycetes are involved. They are found very commonly in environment places like soil, vegetables, fruits, and even in the nasal mucosa of healthy people. So who are infected? People with very weak immune system, like they already have some health problems or take few medications that lower the body's ability to fight germs and sickness. So who are at risk? People with diabetic ketoacidosis, neutropenia, organ transplantation, and increased serum levels of available iron. So these patients are usually immunocompromised. So as I told you before, they have a weak immune system. So now let's see the triggering factors, like why this infection is more common and we are hearing the news and every article which speaks about it. So it's mainly because of the steroids. We would have heard this word steroid very commonly when athletes use them for improving their muscle strength as well as reducing the damages. So similarly, steroids are also used in reducing inflammation in the lungs for COVID patients. But unfortunately, as a side effect, they also reduce the immunity and push the blood sugar levels in both diabetic and non-diabetic COVID patients. So this factor like reducing the blood sugar level and as well as reducing the immune power will be a perfect environment for the moles to develop, eventually causing the disease. So now let's see the types of mucormycosis. The first type is going to be rhinocerebral. This involves sinus and brain. So this infection starts in the sinus and it can spread to brain. This form of mucormycosis is most common in people with uncontrolled diabetes and in people who have had a kidney transplant. So the next type is pulmonary or lung mucormycosis. It is most common type of mucormycosis in people with cancer and in people who have had an organ transplant or a stem cell transplant. Next type is gastrointestinal mucormycosis. It is more common among young children than adults and who have had an antibiotic surgery or medications that lowers the body's ability to fight germs and sickness, basically lowering the immunity. So the next type that we're going to see is cutaneous mucormycosis, that is in the skin. It occurs after the fungi enters the body through a break in the skin, like any trauma or even a burn. So this is most common form of mucormycosis among the people who doesn't have a weakened immune system too. So the next type is going to be about disseminated mucormycosis. It occurs when the infection spreads through the bloodstream to affect another part of body. So this infection most commonly affects the brain but also can affect other organs such as spleen, heart and skin. Next we can see about the signs and symptoms of mucormycosis. For the first type, these signs and symptoms are specific to the types which people are affected. So the first type, as we told, it is rhinocerebral mucormycosis. So there will be symptoms like one-sided facial swelling, headache, nasal or sinus congestion, black lesions on nasal bridge or upper inside of the mouth, and fever. So the next type of signs and symptoms will be for pulmonary mucormycosis. They have fever, cough, chest pain and shortness of breath. Next is cutaneous mucormycosis. They have blisters or ulcers and infected area may turn black. And other symptoms include like normal symptoms of any inflammation, pain, warmth, excessive redness or swelling around the wound. So the next type is gastrointestinal mucormycosis. They include abdominal pain, nausea, vomiting and GI bleeding. The last type is disseminated mucormycosis. They typically occur in people who are already sick from other medical conditions. So it is difficult to know which symptoms are related to mucormycosis. So patients with disseminated infection in the brain can develop mental status change or coma too. So next is the complications. So that includes blindness, meningitis, brain abscesses, osteomyelitis, pulmonary hemorrhages and gastrointestinal hemorrhages. The cause of death due to this disease may be due to an involvement of brain infection or even due to sepsis. The mortality rate is around 50% in this. So the treatment now adapted for this disease is actually antifungal treatment or surgical therapy, that is removal of affected tissue. And thank you for listening. Stay healthy and stay safe.